Hi guys, my name is Dr. Patel. I'm working with Northwest Suburban College, and we are starting a USMLE Step 1 review program. And before we get to the short lecture here on acute rheumatic fever, I just wanted to give my opinion as to what this Step 1 is really about. So, what is this USMLE Step 1? Well, it's not just an exam that's testing facts. Rather, it's an exam that's taking the vast amounts of information that you've accumulated through your basic sciences and testing whether you're able to apply that knowledge practically. And the way that one is able to do that is if you understand the big picture. And understanding the big picture is the point that I'll try and get across here when we look at this small but high-yield topic, acute rheumatic fever. So let's go ahead and get started. So, acute rheumatic fever. Now I have on here on this slide, a sore throat can lead to a broken heart. And we'll see why once we get through a couple slides of this presentation. But first, a few general characteristics. So what is acute rheumatic fever? It is a systemic complication of a very common condition known as strep throat. What is strep throat? It's a pharyngitis that is caused by group A beta hemolytic streptococci, otherwise known as Streptococcus pyogenes. Now what happens? Well, the key here is that it is because of an untreated, again the key word, untreated streptococcal infection. So what happens is a child will get this infection, and about 2 to 4 weeks later, this child will end up having signs and symptoms of acute rheumatic fever. Now, before we get into these signs of acute rheumatic fever, let's go ahead and see why this happens. So how does this happen? It happens through a process known as molecular mimicry. So before we get into what molecular mimicry is, let's talk about what actually happens. So the Streptococcus pyogenes organism has a very, very antigenic virulence factor known as the M protein. So what happens with this M protein? Well, this M protein gets processed by antigen-presenting cells, and once it's processed, it is presented to CD4 T lymphocytes, and then these CD4 T lymphocytes end up inducing our immune system to produce antibodies against what? Against the M protein. Well, okay, that we think would be a good thing, but now what happens? Our body's tissues resemble this M protein. And what tissues specifically? The joints, the heart, the skin, and the CNS. Now, what happens is those antibodies end up reacting to these tissues because these tissues mimic, hence molecular mimicry, this M protein. The tissues that we mentioned make up the Jones criteria. So, we have the joints. What happens with the joints? Now, this is actually the earliest, most common manifestation of acute rheumatic fever, and it is something we call a migratory polyarthritis. Now, what does that mean? That means that as one joint is affected, meaning, let's say the wrist, it'll become red, hot, swollen, tender. That will appear to resolve, and then all of a sudden the same symptoms will appear in the next joint. Let's say, for example, the knee. And so on. So that process will keep repeating itself. Now, when the heart gets affected, we get a pancarditis. What does that mean? That means we get endocarditis, we get inflammation of the endocardium, which is endocarditis. We get inflammation of the pericardium, which is pericarditis. We also get inflammation of the myocardium, which is myocarditis. Now, one thing to keep in mind is that the myocarditis is the most common cause of death in patients in the acute phase of the disease. Now, when the skin is involved, we get nodules, which are called, we get subcutaneous nodules, and we get erythema marginatum. So we have some pictures here. So what is erythema marginatum? It is a painless rash that appears on the trunk and the inner aspects of the arms and legs. And then subcutaneous nodules are usually a sign of more severe disease. They never appear alone, rather this patient will have more of the other manifestations of acute rheumatic fever as well, but they occur on the extensor surfaces of the body, and you can see a few here. You can see one here, here, and here. That one's hard to make out. but they are painless and transitory. And lastly, we have Sydenham's chorea. And what is that? It is simply a rapid and uncontrolled irregular movement of the limbs. So we have two diagnostic criteria. We have the major criteria and the minor criteria. The major criteria we discussed, and they are the Jones criteria. And the minor criteria are few, which include fever, elevated ESR, prior history of rheumatic fever, and evidence of a preceding streptococcal infection. Now, what does that mean? How do we have evidence of a preceding streptococcal infection? Simple. We get an anti-streptolysin O titer. That would tell us that there is or was a presence of a streptococcal infection in this patient. Now, to officially diagnose acute rheumatic fever, we need to have either two major criteria or one major criteria and two minor criteria. Acute attacks tend to resolve on their own, but there's a few things that we can do to manage them. What we can do is give these patients NSAIDs to control the fever and the carditis, and we can go ahead and give them some antibiotics to take care of any residual infection. However, the primary aim here is prevention. So as soon as we diagnose a streptococcal infection, what we should do is to go ahead and get these patients on antibiotics right away so that we can go ahead and prevent the development of this complication. Unfortunately, acute rheumatic fever can become a chronic condition through repeat streptococcal infections and relapses of the acute phase of rheumatic fever. And although the valvular lesions appear very early on in the acute phase of the condition, they become more apparent in the chronic phase. And what we see is mitral valve stenosis, and when the aortic valve is affected, which is less commonly affected, we see aortic regurg. Thank you guys for taking the time to view this video. Hopefully you guys learned something that you didn't already know. So what we have here to offer is small class sizes, individualized attention, and instructors who have all recently taken their boards and have passed and are passionate about helping you guys pass as well. And now here's a quick word from the president of Northwest Suburban College.